afternoon and welcome to Tech Health News. My name is Tahmasyan, and tonight we delve into groundbreaking research that is transforming the diagnosis and treatment of Duchenne muscular dystrophy, or DMD, through the power of artificial intelligence. Stay tuned as we explore how AI is revolutionizing healthcare for patients with this debilitating genetic disorder. Our top story tonight, a recent study published in BMC Neurology, has proven that a deep learning model can diagnose Duchenne muscular dystrophy with an accuracy of 91%, which surpasses the performance of skilled radiologists. This CNN-based model, developed by researchers at Peking University First Hospital, analyzed over 2,500 MRI images, providing a non-invasive, cost-effective diagnostic tool for DMD. Duchenne muscular dystrophy is a severe genetic disorder characterized by progressive muscle degeneration and weakness. It primarily affects boys, with symptoms usually appearing in early childhood. The disorder is caused by mutations in the dystrophin gene, which leads to the absence of dystrophin, a protein crucial for muscle function. Traditionally, diagnosing DMD has relied on genetic testing and muscle biopsies. Genetic tests, while effective, can be expensive and time-consuming. Muscle biopsies, though accurate, are invasive and require specialized facilities and expertise. These methods, while reliable, present significant challenges, particularly in regions with limited healthcare resources. Enter artificial intelligence, AI, particularly deep learning models, are revolutionizing the diagnostic landscape for DMD. The study from Peking University First Hospital highlights the potential of AI to provide consistent and objective results, reducing the dependence on highly experienced radiologists and making early and accurate diagnoses more accessible. The study utilized a convolutional neural network, or CNN, which was trained on MRI images of thigh muscles from 432 patients. The model identified patterns of fat infiltration in muscle tissues, a hallmark of dystrophinopathies like DMD, achieving an impressive accuracy of 91%. This surpasses the 84% accuracy typically achieved by experienced radiologists. The benefits of using AI for DMD are manifold. AI models provide consistent, objective results, processing large volumes of data quickly. This capability is particularly beneficial in early diagnosis, which is crucial for early intervention. Moreover, AI's non-invasive approach makes it a viable option in resource-limited settings where traditional diagnostic tools may not be available. While the potential of AI in healthcare is immense, it also raises important ethical considerations and challenges. Ensuring patient privacy, addressing biases in AI algorithms, and maintaining transparency in AI decision-making processes are critical issues that need to be addressed. Moreover, the integration of AI into clinical practice requires careful planning and collaboration between technologists and healthcare professionals. It's essential to remember that AI is a tool to assist, not replace, healthcare professionals. The expertise and compassion of clinicians are irreplaceable in patient care. AI can augment their capabilities by providing detailed analysis and predictions, allowing clinicians to make more informed decisions. The goal is to create a synergistic relationship where AI enhances the quality of care provided by healthcare professionals. In the next part of tonight's segment, we bring you a heartfelt story of hope and transformation. Meet Lisa, a devoted mother whose young son, Jack, was diagnosed with Duchenne muscular dystrophy at an early age. Thanks to the groundbreaking use of AI in medical diagnostics, here is her story. Good evening, Lisa. Thank you for joining us. Can you share with our viewers how AI played a role in diagnosing Jack's condition early? Certainly. Thank you for having me. When Jack was about 3 years old, we noticed he was having difficulty walking and getting up from the floor, our pediatrician suggested we see a specialist. It was a very stressful time not knowing what was wrong. We were referred to a hospital that was using a new AI technology to analyze MRI scans for diagnosing muscular dystrophies. The doctors used a convolutional neural network, or CNN, to analyze Jack's MRI images. Within minutes, the AI identified patterns that identified Duchenne muscular dystrophy. This early and accurate diagnosis was something that we didn't expect, but we're grateful for.
How did this early diagnosis impact Jack's treatment and your family's journey?
The early diagnosis was life-changing for us because we caught it early. We could start Jack on a treatment plan right away. He began receiving therapies and medications that have slowed the progression of the disease. We also became part of clinical trials for new treatments. Knowing what we were dealing with so early allowed us to take proactive steps to manage his condition.
What kind of support did you receive following the diagnosis?
The hospital provided us with a multidisciplinary team that included neurologists, physical therapists, and genetic counselors. They guided us through every step, explaining the condition and helping us navigate treatment options. The AI diagnosis also connected us with other families going through similar experiences, creating a support network that has been invaluable.
Looking forward, what are your hopes for Jack in the role of AI in his ongoing care?
I am hopeful that AI will continue to improve and provide even more personalized treatment options for Jack. The technology already monitors his progress and helps adjust his treatment plan as needed. I believe that as AI advances, it will offer new therapies and possibly a cure. For now, it gives us hope and a sense of control over his condition.
Do you have any final thoughts you'd like to share with families who might be going through a similar situation?
Of course, to any family facing a diagnosis like ours, I would stay hopeful and seek out the latest technologies and treatments. AI made a huge difference for us, providing an early diagnosis and guiding us to the best possible care. Don't be afraid to ask questions and advocate for your child. There is so much support and innovation out there that can make a real difference.
Thank you so much for sharing your story, Lisa. Your experience highlights the incredible impact AI can have on families dealing with DMD. We wish Jack all the best on his journey.
This segment was brought to you by Health Tech News, highlighting the real life impact of AI in medical diagnostics. Thank you for watching and stay tuned for more stories of hope and innovation.
In our course, we discuss the complexities of diagnosing and managing Duchenne muscular dystrophy. Traditional diagnostic methods like genetic testing and muscle biopsies, while effective, are invasive, costly, and time-consuming. This is where AI has shown significant promise. We learned that AI, particularly deep learning models like convolutional neural networks, can analyze MRI images to identify patterns of muscle degeneration characteristic of DMD. These models can provide faster and more accurate diagnoses. Let's dive deeper into a hypothetical case study. Imagine a young patient showing early signs of muscle weakness. MRI scans are taken and analyzed using the CNN model, which identify patterns indicative of DMD. Genetic testing is then performed, and the data is processed through machine learning algorithms to predict the patient's response to various treatments. Based on these insights, a personalized treatment plan is developed, incorporating AI-optimized stem cell therapy. Regular MRI scans are monitored by AI to track disease progression and adjust the treatment plan as needed. In our next segment, we explore how AI is not only revolutionizing the diagnosis and treatment of DMD, but also extending its transformative power to other genetic disorders. Dr. Stevens, thank you for joining us. Can you start by explaining how AI is being used to diagnose rare genetic diseases?
Yes, hello. Sorry, I'm not in my lab coat, but I do have my goggles. Thank you for having me. AI is proving to be a game changer in the field of rare genetic disorders, which are notoriously difficult to diagnose due to their low prevalence and clinical heterogeneity. Traditional methods often involve a long and arduous process of genetic testing and clinical evaluation. AI, particularly machine learning and deep learning models, can analyze vast amounts of data quickly and accurately, identifying patterns that might be missed by human doctors. One notable example is the use of AI in analyzing genetic and clinical data to expedite diagnosis. For example, AI models can sift through extensive data sets from patients' registries to uncover potential genetic markers of diseases, which significantly reduces the time required for diagnosis. A great example of this in action is the application called Face to Gene. It uses computer vision and techniques to analyze facial photographs of patients. Many genetic disorders have subtle facial phenotypes that are difficult to recognize. Face2 gene can detect these patterns and suggest potential diagnoses, making it a valuable tool for clinicians.
That's fascinating. How is AI being used to tailor treatment plans for patients with rare genetic diseases?
AI's role extends beyond diagnosis to treatment personalization. By leveraging machine learning algorithms, AI can predict how patients will respond to different treatments based on their genetic and clinical data. This enables the development of personalized therapeutic regimens that are more effective and have fewer side effects. AI can also help in identifying drug repurposing opportunities, where existing drugs are used to treat different conditions based on genetic similarities. One innovative AI platform making strides in this area is Canrin, developed by the Hugh Call Precision Medicine Institute. This platform uses knowledge graphs to integrate literature and databases, helping to identify potential therapeutic strategies for rare diseases. It has already benefited over 500 families by streamlining the process of matching patients with appropriate treatments.
Looking forward, what do you see as the future directions for AI in this field?
The future is incredibly promising. We are moving towards second generation AI systems that prioritize patient centric care. These systems not only assist in diagnosing and treating diseases, but also monitor patient responses and adjust treatments in real time. AI's integration with telemedicine and the growth of health databases will further enhance our ability to provide personalized and efficient care. Moreover, AI driven virtual clinical trials can significantly expedite the development of new treatments for rare diseases.
Thank you, Dr. Stevens, for sharing these insights. It's clear that AI has the potential to transform the diagnosis and treatment of rare genetic disorders, offering new hope to patients worldwide.
In conclusion, AI is not just a tool for the future, but a powerful ally in our current fight against rare genetic diseases. By harnessing the capabilities of AI, we can improve diagnostic accuracy, personalize treatments, and ultimately provide better outcomes for patients. Stay tuned for more stories on how technology is revolutionizing healthcare. This segment was brought to you by Tech Health News, highlighting the latest advancements in medical technology. Thank you for watching and stay tuned for more stories